Fox 5 Morning News at 9.
A local organization is looking for your support for hospitalized newborns. Joining us now, Dr. Sean Donishman. He's the founder of Miracle Babies. Dr. Donishman, good morning and good to see you.
Good morning, Shelly. Always a pleasure to see you.
I have so many questions, but first, for anybody who may not be familiar with Miracle Babies, I love your organization. What exactly do you guys do?
Thank you so much. Well, it's a nonprofit organization that was started about 11 years ago. We used to raise money for families for making sure that parents are united with their sickborn. So we used to actually give a check to families when they have babies in the neonatal intensive care unit or in the cardiovascular intensive care unit. But as of 2020, Shelly, we started actually listening more to our parents, where they use the money mostly for transportation, gas, and parking. So now we're actually shuttling parents to and from the hospital. But obviously, as you know, with this COVID-19 pandemic, now we can't do that. So right now we're asking for gas cards. So we're asking for donations for gas cards because parents still need to get to the hospital. Unfortunately, pregnancy complications haven't reduced. Parents still have babies in the ICU, so we need to support them as much as possible.
Dr. Donishman, could you talk a little bit? We have a big population here in San Diego that getting ready to have babies, and we know that pregnant mamas are so nervous right now because, as if with any baby, especially babies that go into the NICU, their systems are already so new and so weak to viruses. Are you concerned about a baby being exposed to this virus? Because we did recently have the news, even though the details are not out yet, about the first infant under the age of 1 who died from this virus.
Right. Well, Shelly, I mean, we're learning every day something new. I mean, as of now, we don't have any proven cases of vertical transmissions from moms to babies.
Okay.
There are a couple of cases that there may be some potential vertical transmission, but still, we're still telling patients that as of now, we don't have any real data in regards to, again, a mom transferring the virus to the baby. Obviously, we're taking all the precautions that are necessary. You know, again, it's very difficult if a mom has, for example, tested positive for COVID-19 or is a PUI or a patient under investigation. Parents can't see their babies. So this is a big problem for moms who tested positive, for example, and can't see their children in the ICU. But so far, thankfully, you know, our patients pregnant women are most of the time healthy, right? They're young and they've got good immune systems. So far, knock on wood, we haven't seen any really bad cases. I can tell you that at least as far as we're concerned at our hospital, we have not seen a patient, thankfully, come in with respiratory distress.
Okay.
So we're fortunate with that.
What hospital are you at, Dr. Donishman?
I'm at Scripps.
You're at Scripps. Okay. And then have you guys changed your practices and your protocols with NICU? Like the little bit, I came and I visited you one time in there, and those,
I know.
Oh, the sweet little babies. They were so tiny.
Well, we miss you. Like you mentioned, you know, obviously these children are very fragile. They're very premature physiologically, and they don't belong certainly out of mom's womb unless they're absolutely necessary to come out. But yeah, absolutely. Every hospital is taking their precautions. We limit the number of visitors. Obviously, right now it's only limited to the parents.
Okay.
There are no grandparents or any other family members that can get in. Even with in regards to the office and hospital visitations, not just the NICU. I mean, we're trying to limit contact with our staff and our patients and just minimize exposure as much as possible. So a lot of changes, again, daily happening because we're learning something new every day.
Yeah, and during the time that I came to visit you a few years ago, we were talking about the challenges when you do have a baby that's in the NICU and you need to go back and forth. And there's some families that it creates some hardship because you want to be there for that skin-to-skin contact, but you have to go home and take care of your other kids. There are people who are watching right now, Dr. Donishman. They're looking for ways to be able to help places in San Diego. Tell us again about how people can reach out besides the gas cards. Is there anything else that people can do for Miracle Babies?
Shelly, thank you so much. I mean, right now, honestly, it's gas cards. I mean, if there's any way people can donate, even a small amount of money, that will go a long way. Right now, since we're again limited as far as what we can do in regards to transportation, and also we can't get into the hospitals to do miracle hours or provide packages for for parents. This is a lonely time, and remember, now schools are closed, and patients have children at home, and so they have to cover expenses, for example, for childcare. But again, prematurity doesn't stop. In fact, with COVID-19, if a mom is infected, the most likely complication is a premature birth. So you can go to our website at miraclebabies.org. You can text us at 44321. And put gas cards, and it'll direct you to a website. People have been donating through that as well. Right now, the biggest thing is allowing for our moms at least to get to the NICU, because, again, like you mentioned, these are difficult times. And when a baby is born prematurely, they need their mom there. They need the mom's voice. They need the mom's breast milk, the mom's touch, if possible. So it's crucial that we don't forget about our little ones, and as much as possible, if you can, please support. We love it.
Dr. Daneshmand, appreciate you chatting with us. I have a feeling you're going to see some gas cards popping up. There are people in San Diego
everyone loves
waiting
you,
to help.
Shelley. We'd love to see it on your Instagram post, too.
Oh, definitely, definitely.
We miss you. Thank you so much.
Thank you, Dr. Daneshmand.
Thank you for having us on. Thank you. Bye-bye.
And by the way, if you want to help, Chrissy, we'll get the information for you up on our website. I've been in that NICU unit. Oh, Chrissy.
Oh, yeah.
The little baby.